welcome to a new SciPod. Here we explore how discoveries in chemistry, biology, and medicine are helping to tackle real-world challenges in environment, healthcare, and beyond. Whether you're a science enthusiast or simply someone driven by curiosity, join us as we make cutting-edge research accessible and inspiring for everyone. My name is Amanbek Bekturgan. I'm first-year master student in life sciences.
Yeah, and my name is Balkiya Ospan. I'm a second-year undergraduate majoring in biological sciences.
Today we are delighted to welcome Dr. Ellina Mun.
Dr. Mun is a PhD-level researcher with a background in chemistry and pharmacy. Earning her PhD at Aruzhan University, she started a postdoctoral position in the School of Biomedical Engineering at the Purdue University for Cheongkondan Pharmaceutical Corporation, which was the first company to localize a drug production in South Korea. And after working at the edge of industry and academia for 2 years, she joined the stem cell laboratory of the National Center for Biotechnology in Astana as a leading scientist. And now she serves as an assistant professor in the Department of Chemistry at Nazarbayev University. So her main research interests are nanoparticles, polymers, and drug delivery.
In this episode, we will get to know the professor and take a deeper look into the mysterious world of nanoparticles. What are they and how are they used in drug design and therapeutics?
So listen in, learn, and discover the incredible ways science is changing our world. So hello, Professor. How are you feeling today?
Hello, I'm good, thank you very much. Thank you for inviting me to this podcast, and overall, thank you for this great initiative.
Yes, we're also delighted to have you here today.
Yes. So we wanted to start with your postdoc research at the Cheongkondan Pharmaceutical Corporation, as I mentioned before. So can you tell us how it all started for you?
So it started nearly right after I finished my PhD studies at the Reading School of Pharmacy of the University of Reading in the UK, and it sort of was a moment of being at the right place at the right time. Because initially I wasn't looking for positions in the US. I was mostly focusing on Europe and in particular the United Kingdom. And to be honest, I was a bit skeptical about the US as a country. But then one of my supervisors told me, why don't you try? Because the professor whom I was working for during my postdoctoral studies is probably one of the top figures in the pharmaceutical world, pharmaceutical science, and he is a role model to many people, including my supervisors of my PhD studies. And then I thought, yes, why do I restrict myself from some preconceptions, due to some preconceptions from any possible opportunities? So I decided to apply, but the position was not opened. And why I'm saying it was a moment of being at the right place at the right time, it was not advertised globally. It might have been advertised to the US, but I didn't see the advert. So I just emailed the professor asking if he might have any open positions in his research group. And I didn't know that it was about a year when they created a commercialization hub for this Korean pharmaceutical corporation, CKD, and they were functioning to help them to market to the European and US market based on at Purdue University at the School of Biomedical Engineering. And the team consisted half and half. Half was represented by the US professionals and half by the Korean professionals who on rotation were going to the US to spend 2 years each, and they were around 3 to 4 people, so they needed to have 3 to 4 people from the US side as well. And they were lacking one person.
And it was lucky you.
Yes.
Okay.
So right as soon as he read my email, he replied, "Can I call you?" So he just phoned me, conducted a phone interview, and said that I do not have like research positions in my research group, but I have this instead. If you will be interested, I said, of course I will be, because at that time I was trying to decide for myself whether to stay in academia or to move, to shift to industry, pharmaceutical industry. And that position was the perfect opportunity for me to find out what the pharmaceutical industry world is like. So this is how I joined. I had about 2 weeks to pack the 5 years of life in the UK and move to the US. So yes, this is how it all began.
Wow. Um, I think CKD pharmaceutical company is multi-directional, so it has
Yes.
different research studies and areas. Which particular one did you choose when you moved there?
Um, I wasn't really able to choose because in pharmaceutical industry you are mostly tackling the tasks that are given to you. So as a team based at Purdue University, we were helping the CKD to commercialize to the US market. They were preparing a few formulations, the drugs that they have developed, to be approved by the FDA, Food and Drug Administration in the US. And we were simultaneously working on 3 projects for them. First, we were developing a drug delivery technology for opioid abuse. So it's not a common problem for Kazakhstan yet, but in the US before the pandemic hit over, the opioid abuse was called by the President Donald Trump. It was at that time it was his first presidency, so it was given the status of epidemic, and all the drug delivery technologies aiming to solve the opioid drug abuse were given the #1 priority. Of course, then later when the pandemic happened, the COVID vaccines were given the priority #1. But yes, the opioid is the problem because opioids are very often used for the treatment of the late cancer patients. And the problem is that when drug abusers get their hands on these opioids, sometimes it can be lethal. Or same for the elderly patients when they need to periodically take these opioid drugs. Sometimes a patient forgets that he or she took the dose and he mistakenly takes the second one, and this dose may be also lethal.
So opioid is some kind of a drug in this case, or this
It is a class of drugs. Opioids, they mostly, drug abusers can use opioids, and also it is mostly used for as pain relief for late cancer patients. And this is why it is important to prevent the drug abuse for both patients and possible drug abusers. And this is why it is important to have some sort of a technology that would control the release of these opioid drugs inside the body. And we were working, one of the projects of our group was focusing on the development of such technology. The second one, we were helping to release 2 drug formulations that were developed by the CKD, not us, the novel drugs, to the approval of FDA, and those were 3. And the third one was the PLJ. PLJ is a polymer, polylacticoglycolic acid, that is, the polymer itself is already FDA approved, and we were developing a drug delivery platform based on this polymer for a sustained drug release. So those were 3 main directions, and partially we were also involved in the design and the study of the liquid crystal drug delivery formulation. This is an in situ formulation that you can simply inject under the skin, and it will be liquid upon injection, but once it is injected, it would turn into a gel-like structure and would slowly release the drug. So the technology was developed by CKD a couple of decades ago, and they were having problems with clinical trials. They were very successful in all the animal models, but the clinical trials over and over again were failing, so we were helping them to find out what the reason was. So that has to do with a deeper investigation on the properties of the formulation per se. So these were the main projects of our group at Purdue University.
Did you succeed at all objectives that your group had on this project? Or?
Partially, yes, before I left, but the projects were ongoing and they are still ongoing. But yes, the part when we were helping them to commercialize to submit the application to FDA on the novel drugs, yes, that was nearly submitted by the time I left.
So working for the South Korean corporation, you gained a lot of experience. But after 2 years, you decided to join the National Center for Biotechnology in Astana. So why did you decide to focus more on academia now after the industry?
Yeah, that's a good question. I always knew that eventually I would go back to Kazakhstan because I wanted to, after gaining some international experience, I felt like I already have something to give Kazakhstan back. But I didn't know it would happen so soon. So after spending 2 years with the team at Purdue University working for CKD, at the time I thought that maybe industry, that I want to try myself in industry. And I was aiming to, if industry, then I was considering the upper management. And for that roles, you have to have your MBA degree. So I was actually, while still staying in the US, I was actually preparing to apply for business schools in the UK and in the US. And then it was time when I came across with my colleague, Dr. Ugay, from he was at that time he was the head of stem cell laboratory at National Center for Biotechnology. Now he's the acting director of the NCB, and he just offered me, why don't you come? And we had an idea for the project, for a collaborative project. They didn't have any chemists in the team. The whole NCB is mainly consists of biology professionals and scientists, and I decided why not. And this was the time when I returned back to Kazakhstan, and then I gradually shifted to Nazarbayev University just because they started collaborating with many people from biology department in particular first. And by the way, I came across with biology department faculty before I joined the chemistry department. This is how I started my collaboration, and then I gradually shifted to Nazarbayev University. And yes, I ended up in academia, and I have no regrets.
So life flow is like really unpredictable. So you could be doing one thing in the past, and now you're doing completely different things. With your degrees in chemistry and pharmacy and background with polymer chemistry, now your research focus is mostly on nanoparticles. Am I correct?
Yes.
So what made you interested in this specific field? So like,
it all started back at my PhD studies. So actually my PhD thesis was dedicated to the development of studying and development the nanoparticle based drug delivery systems that can potentially be used for the intravesical drug delivery to the bladder, urinary bladder. And I didn't stop. As you know, any project always merits continuous studies, so I didn't stop after I finished my PhD working on that topic, and I'm still working on that topic. And this is how nanoparticles became a part of my life, and this is how I became and I'm still interested in nanoparticle-based technology and generally nanotechnology for pharmaceutical and biomedical applications, because they hold quite a high potential as drug delivery vehicles. Generally, they are designed, particularly for the pharmaceutical science, they are designed to improve the efficacy and safety of all the drug treatments existed.
So you worked as a scientist in industry and academia, but also we know you as a woman supporting other women in STEM. And recently you were one of the leading figures in establishing a social project which is dedicated to empower girls and women in STEM education. So can you tell us more about it? Like, why do you think it's important to support such projects and kind of invite more girls into the STEM?
Generally, globally, I think there is a certain level of disparity between gender disparity in the STEM disciplines, and for some reasons for women it may be more difficult to reach the same goals in the field, in the STEM disciplines. Why is it? I think it is important in particular to Kazakhstan because on top of the global disparity, gender disparity in STEM, in Kazakhstan we have got also some historical or socio-cultural stereotypes of the role of women in the society, in families. And with this project, and by the way, this project we started with a colleague and a friend of mine, Dr. Lisa Lim from the Graduate School of Public Policy, and it all started at a cup of tea, just as a conversation. She is a U.S. citizen, so she is originally from the U.S. So she just asked me, and at that time she spent only about a year in Kazakhstan. So for such a short period of time, she noticed and asked me, why are there so few women in the, not generally in the workforce, but in the government, in the decision-making positions. And I tried to explain it to her, and this is how we decided to start an initiative that would support and provide all the necessary encouragement and support for young girls and women. And we intended to grow into a large mentorship scheme that we are hoping to start by the end of this year. So as for example, the high school students would have their mentors in the as the current, for example, in new students, the current and new students would have their mentors in the scheme as faculty or professionals from industry and so on. So we want to create this chain of support and mentorship through generations. And it is important because for young girls and women who probably who are trying to succeed, to pursue their goals in STEM, sometimes they cannot do it for the lack of some type of resources, whether it is information, whether it is a lack of role models in the field. There is no one to ask, to talk to discuss things with. And I also am mentoring different students locally in Kazakhstan and abroad. And I thought, why don't we create this mentorship scheme for the interested young girls and women? I'm not saying there is something wrong with the traditional form or scheme of families when women are more to take care of the household. That is totally fine as long as it works equally well for both people in the family. And we are not trying to change minds of everyone, all the girls and women, all population in Kazakhstan. We are aiming to provide the support for those who are aiming, who wants to pursue some goals in the STEM, but who doesn't have some instruments or resources, certain resources to do so. So this scheme, mentorship scheme, will be designed to do this, not to change the minds of the Kazakhstani society, but to provide the support for those who need it.
And you mentioned that we lack some women role models for young girls. So did you have some kind of a role model for yourself when you were studying, for example, at college, university, some woman figure who you were aspired to be?
I would say I didn't have particularly a woman figure, but I always had my role models in my life. I genuinely think I was blessed to meet amazing people in my professional and personal life, like my supervisor starting from my bachelor's degree here in Kazakhstan, and then my supervisors in my PhD studies. I had two supervisors, they both were great role models for me, and I learned and I still keep learning from them. We still keep in touch and we still collaborate, we work together. And this year we had our first PhD student defending her PhD thesis together. So they were great role models for me because I didn't didn't tend to divide males and females in the professional world. So it just happened to be that even nowadays, most of my collaborators are male scientists. And yes, and even beyond my PhD studies, when I started my postdoctoral position, there we had a few advisors of our team, not academia based from the industry. The Professor Kinan Park, whom I was working for during that time, he is a great role model not only for me. Then when I joined NU, I also met quite a few amazing people who are still my role models, my colleagues. Yes,
Thank you.
and collaborators.
Yes, I think having someone to like have your back and support you and overall to get some helping hand from someone who is actually proficient in your field is very helpful for a lot of people, especially women in STEM. So, considering current development efforts, what do you think? What are the future prospects of increasing women's engagement with educational opportunities?
Particularly to Kazakhstan, I'm not sure about the prospects, but I'm very glad and happy to see within our Nazarbayev University. I'm very happy to see so many bright and talented students who are trying to achieve their goals in science, who are pursuing their goals. But the problem here for Kazakhstan will be, for example, among students, the gender distribution is equal for STEM disciplines. It's about 50 to 50. We can see many female students pursuing their degrees in engineering, in chemistry, in biology, in medicine. But for Kazakhstan, the problem is that among those female students, not all of them are pursuing their career in the field.
Like
They're getting their
later.
diplomas, they're going to higher education, they're getting even their master's and PhD degrees. But probably due to some cultural, historical stereotypes, only a negligible percent of them are continuing to grow as professionals in the field. So this is what also one of the issues we are trying to tackle. It is okay if a female student herself doesn't want to do anything career-wise, but with such initiatives, we are trying to provide the support for those who are trying and who wants to pursue their career in STEM after completing their bachelor's, master's, or PhD degrees.
Yes, so you greatly mentioned about the challenges that mostly women face in pursuing their some kind of scientific career in academia, etc. And as we know, this can be very hard sometimes to balance your personal life with some professional demands in your sphere. So as far as we know, you were recently on your maternity leave. So can you like describe us how it affected your research activity mostly?
Research activities. There I say it didn't affect.
Really?
Yes, but it happened for a few reasons. And not only reasons, mostly people. First of all, going back to the difficulties, yes, just down to the biological functions, it is more challenging for women to stay on track with your professional career. It can be more challenging and more difficult, yes. But in my personal case, why it nearly didn't affect my research activities, first of all, it was a very careful planning. So before going on my maternity leave, that was exactly 1 year ago, I was trying to secure a few project funding to make sure that my group can exist with no problem during my maternity leave and even after my comeback. Also, the brilliant team that I was fortunate enough to build before the maternity leave, that we have now, I think, 14 students in our team. They all are very hardworking, very talented, and they managed to keep going even without my close supervision for the couple of 3 months that I was absent, nearly completely absent. And my colleague, who used to be my PhD student, and this year she graduated, her name is Balnur, so she was able to substitute me in many questions, in many positions within our team at the time of my maternity leave. And my collaborators, who were also very supportive of me, and even one of them very happily stepped in. He is a co-PI of one of my projects. And during my maternity leave, it turned out that I couldn't continue being a PI of my project whilst on my maternity leave. So he very happily stepped in to cover me for those 3 months that I was absent. And yes, and then I gradually came back in 3 months. And I was first back part-time in April, and then now I'm back full-time since August this semester. So yes, it wouldn't be possible without the help from all of those people, my team, my colleagues, and my collaborators.
Thank you for sharing.
Yes, I think it's actually great to have a good, brilliant team that could support you at any times, at the moments when you have like some other things that you like to do. So now that we have talked about your research team, we would like to shift to the overall your research, Dr. Ellina Mun. So previously you have mentioned that you work with nanoparticles, and you have described that nanoparticles help us to deliver some drugs in our bodies. However, personally, I do not quite fully understand what these nanoparticles really are and how can they be used and designed to deliver these drugs in our bodies. Could you please elaborate a little bit more on what are the nanoparticles exactly are, and what kind of properties make them special compared to other delivery methods?
So nanoparticles are generally nano objects with the size dimensions somewhere between 1 to 100 nanometers in all 3 dimensions. So they can be of different shapes. They can be spherical, for example. And they find their application in various fields of our lives, including medicine, including drug delivery. Some people, though, are very skeptical about the nano-sized objects. They say you can simply grind everything down to nanosize and you will end up with nanoparticles. But jokes aside, nanoparticles provide many benefits, in particular for the drug delivery. First of all, it's the small size and large surface area. We can tune their size, their morphology. You can load the drug or any biologically active compounds of your interest inside or on the surface of these nanoparticles. You can decorate the surface of these nanoparticles by different targeting moieties, for example, to enable the targeted drug delivery, which is, for example, important for cancer treatment. When you want to deliver particularly to the cancer cells, so as to avoid the side effects to the healthy tissues. So these are the major advantages. But generally, as a drug delivery vehicles, nanoparticles, so the whole idea is basically to enhance the efficacy and bioavailability of drugs. You can load the same drugs, low molecular drugs, inside these nanoparticles. They can be either encapsulated inside this vehicle. These nanoparticles can be made porous, so your drug can be sitting inside the pores, or you can covalently attach the drug on the surface of these nanoparticles. So this is how you would deliver and enhance the efficacy of the same drug in the body. Also, these nanoparticles can help to evade our immune system. So as you know, our immune system is very smart. So any foreign body that gets inside our body, our immune system will try to get rid of it. So these nanoparticles can help to avoid, to screen these drugs from our immune system. And this can be done by certain tools and technologies, for example, pegylation. So you can attach, the peg is a polymer, so you can attach this polymer on the surface of these nanoparticles, and in a way they will become invisible from our immune system. Also, nanoparticles for the drug delivery are particularly important because they can improve the bioavailability of poorly water-soluble drugs. So when the drug is hydrophobic, meaning it will not dissolve in water, so of course it will have a very low bioavailability in the body, and you would probably need very, very high concentrations of this drug to be effective. But with the use of nanoparticles, you can load the needed concentration of the drug inside and to deliver it. So the hydrophobicity of the drug, the problem of hydrophobicity, will be overcome with the use of these nanoparticles. Also, bioimaging agents in bioimaging can be used with these nanoparticles, and these are just a few applications in particular for the biomedical field that nanoparticles can serve as a good tool for.
So bioimaging is, can you explain what it is in simple terms?
Same as you would attach or load the drug inside these nanoparticles. For bioimaging, you can use this contrasting agent to be loaded inside or somehow attached to these nanoparticles.
So it's kind of a mechanism, yes?
Yes, so they would potentially also improve the efficacy or in some cases toxicity levels of these imaging contrasts for CT, for example, computed tomography.
From your description of nanoparticles, I can envision them as like these small building blocks that we could use to create some vehicles to deliver drugs. So I think that these building blocks could be different. So nanoparticles could be built out of many substances, substrates, and you mostly focus on polymer-based nanoparticles. Am I correct?
We are now shifting towards polymers. So now, as a group, we are working with polymer-based nanoparticles for drug delivery as well. But we started from the opposite. We started from inorganic materials. Yes.
So, for example, can you tell us?
We started working with organosilica. So silica is an inorganic component in the system, and it has, as opposed to the traditional silica, it has got some organic component in the structure. So even though for the drug delivery, having something inorganic is not always preferable because of the toxicity reasons and issues, but we are aiming for the intravesical, nearly the local drug delivery. So we will not be delivering systemically through the bloodstream, but intravesical drug delivery is designed to deliver inside the urinary bladder. So what our particles are supposed to be doing is to helping the drug to reside on the surface, on the lining of the urinary bladder for longer. So due to some physiological functions, everything that comes in, for example, through a catheter, in the urinary bladder will get washed out very soon. It's just physiology. Every 4 hours, the cycle of filling up and washing out is complete. But what our nanoparticles are doing, they are mucoadhesive, which meaning they are sticking onto the mucosal membrane that are lining the inside of the urinary bladder. And this is how our nanoparticles are helping the drug to reside for longer periods of time. So the nanoparticles would stick to the urinary wall of the urinary bladder, and the drug will get released. And through a few washing out cycles, physiological, they're supposed to be staying still. So that is supposed to enhance the patient compliance, just because you would need fewer procedures of catheterization to place the drug inside the urinary bladder. This is one of the example. And later on in our collaborative projects with National Laboratory Astana, we started working recently, quite recently, last year or a couple of years ago, working on polymer-based drug delivery systems for colon cancer treatment, and that system is based on PLGA, which is a biocompatible, biodegradable polymer that is already FDA approved, and this is why we chose that system.
Thank you.
So, you mentioned that nanoparticles could be like synthesized to have special properties and to like, for instance, you have mentioned that they could reside in our like urinary organs due to their specific surface modifications. How does the process of nanoparticle synthesis go in general? Like, are they like synthesized separately and then we implement drugs inside, or
It varies.
it varies?
First of all, it will depend on the type of nanoparticles you're working with. For example, if we are talking about polymer-based nanoparticles, usually these are emulsion-based techniques that would make the nanoparticles. For example, PLJ, you're simply creating an oil in water emulsion. So it would look like the same as if you put olive oil in water. And then you provide high energy source, for example, homogenizer or ultrasound, and you can load the drug at the time of the synthesis, and then with the help of a water miscible non-solvent, as the solvent leaves out of the oil phase, which is the polymer, your nanoparticles or even microparticles can be synthesized by the same way, will solidify, and the drug will end up sitting inside, and the polymer will be serving as a shell around the drug. And then once the solvent will be leaving, the nanoparticle will be shrinking in size. So basically here we will be going through something larger to something smaller. But if we are talking about inorganic, for example, silicon nanoparticles, there the synthesis, the formation will proceed other way around. We will be starting from the nucleation. So first the nucleus of the nanoparticle will be created, and then by further aggregation and by further addition of your monomer to the mixture, your nanoparticle would grow in size until it reaches the colloidal stability. So it would vary. And the drug can either be added during the synthesis, like in case of the PLJ-based nanoparticles, or alternatively in silicon nanoparticles, like what we are doing at the moment in our group, we are synthesizing the nanoparticles separately. So we are making them, we are fully characterizing them, and then as a second step of synthesis, we are covalently attaching the drug onto the surface of these nanoparticles. So for this, you have to have your nanoparticles already prepared, dried and purified, and then you can attach not only the drug, it can be some biologically active moiety that you would attach onto the surface, or you can synthesize porous nanoparticles, and then you can load the drug inside those pores, again as a second step of the procedure. So it will depend on the material of your nanoparticle and the type of the drug you're trying to load.
So you mentioned, no, you described the synthesis of how nanoparticles, how drugs can be located inside the nanoparticles. So can you tell us more about how the type of drug affects this mechanism? Like what kind of other size-like mechanisms do you use for other kinds of drugs?
You would firstly need to know the type of the drug you're trying to load, and the first aspect to look at will be probably the solubility of your drug and your, well, if it is a polymer-based nanoparticle and your polymer in water, then you will be looking into different other solvents. But it will also depend on the properties and nature of the drug. For example, if it is a hydrophobic drug, then probably a polymer-based matrix will be suited better. For example, PLJ, just down to its hydrophobic nature, it will be able to accommodate the hydrophobic drug inside its core. So this is why PLJ polymer-based nanoparticles can be used to enhance the bioavailability of poorly water-soluble drugs or hydrophobic drugs. So it would mostly depend on the properties of the drug you're working with. Alternatively, like what we are doing with our silicon nanoparticles, you can modify the drug molecule before, for example, we are attaching covalently our drug onto the surface. But to do it, you first need to modify your drug. So as this drug would have some functional groups, so as later it can be attached to the surface of your nanoparticles. So this would add a few more steps of synthesis of the procedure. Yes, so it would affect the synthesis overall. It would firstly depend on the properties and type of the drug, on type and the properties of your nanoparticle, and of course the eventual application of your drug, route of application, whether it is oral, systemic, via injection, delivery, transdermal, topical. So many aspects have to be considered.
So in nanoparticle drug design, we could change both nanoparticle coating and as well as the drug inside of it, right? So for the nanoparticle coating, you have mentioned previously that we use, for instance, like chemical groups like PEG or thiol groups. So could you please tell us how do they increase the efficiency of drug delivery, and how do we choose those specific chemical groups? How do we know that we need those specific ones for our particular purposes?
Well, let's start from the thiol groups. So in our case, we selected the initial precursor for the synthesis of our nanoparticles to have already the thiol groups on the surface. So this is why when we synthesize the silicon nanoparticles, they end up with the number of thiol groups on the surface. Why we wanted thiol groups is because thiols are quite reactive functional groups, and these potentially can further be used for further modification of these nanoparticles. At the moment, we are using these thiol groups to functionalize the surfaces of our nanoparticles with PEG, polyethylene glycol, which is a polymer itself, and as I mentioned, it helps to screen our nanoparticles from the immune system if they are delivered systemically through injection. These can also enhance the toxicity profile. The PEG can enhance the toxicity profile of our nanoparticles, and the same thiol groups are used to attach the drug, anti-cancer drug we are working with at the moment. We first modify the drug to have some either thiols or malamide groups that are reactive with the thiols, and then it happens through the click reaction. So while another reason why thiols is because thiols can click react with either thiols or malamide groups.
So what is click reaction? Can you say?
Click reaction is a simple reaction that does not require any particular conditions or no catalyst. They just click. So
just,
when you put two components together, they would just click, just because the reaction is both thermodynamically and kinetically favorable. And you wouldn't need any specific condition for this to happen. As long as two components are together, they would click. And for the drug delivery field in particular, it is important because when you are developing a drug delivery technology or device, it is important not only to have your device or technology approved as a safe, but also every single component used at every single stage of your synthesis and the process has to be approved, approved to be safe. And this is why the less components you have in your synthesis, the better. It will simplify your life at the stage when you will be lucky, if you will be lucky enough to be getting clinical approval for your drug delivery technology and device. So the less components, the simpler the chemistry of your process, the better for the clinical trials.
Okay.
I see. So now that we have our nanoparticles synthesized and drug already incorporated into it, when we introduce the nanoparticles in our organisms, how do we know where they will end up at? Or do we like inject them locally and expect them to stay there all the time?
That is probably a decade of investigation question. Because you wouldn't know the answer unless you try it and see.
Mhm.
So last year we conducted our in vivo studies of our nanoparticles to see where they end up at.
Mhm.
Because it is important not only to load the drug inside the nanoparticles to make them deliver the drug, but also then to see how they get excreted out of the body after they fulfill their main function of delivering the drug. So for our silicon nanoparticles, we presumed it would happen through renal system. So usually the excretion of the any foreign bodies, any drugs, any medication happens via either of two routes. First one is the renal system through kidneys, and the second one is hepatobiliary through liver and intestine. So we expected our silicon nanoparticles to be excreted through kidneys, which is the renal route, but we saw the opposite. It was excreting from via the hepatobiliary pathway, meaning it would go through the liver and then intestine to be excreted from the body. Also, it would vary case to case, again depending on the type of nanoparticles you're using. For example, if the same pegylated nanoparticles, when you use that PEG, the polymer that would help us to screen these nanoparticles from our immune system. At the same time, you cannot pegylate too much and you cannot screen too hard from the immune system, because if there will be too much PEG, they will become so invisible to our immune system that our immune system will not be able to eliminate them. They will end up circulating inside your bloodstream. So this is why it is important when pegylating to actually pay attention to the degree of pegylation, on how invisible you want these nanoparticles to be from the immune system. So there is no single answer to that question. Again, it will depend on the type of nanoparticles, on the type of administration, whether you are injecting subcutaneous under the skin, if you are injecting into the bloodstream, IV injections, IM, intramuscular injections, or you're delivering orally. So that would, each individual technology or device developed has to be tested.
So what about particularly about chitosan and organosilica? Like you above before mentioned about the differences, like the organosilica is made from it is inorganic nanoparticle and chitosan is more organic, and how does this affect their digestion? So can you elaborate more on that?
Generally, chitosan is a polymer. It is a polysaccharide natural class of polymers, and generally everything natural is more degradable. So eventually, yes, all the drug delivery devices and technologies are supposed to get either eliminated or degraded inside the body. So the beauty of using polymers as the drug delivery platform is that particularly natural polymers are well degradable. They're known to be biodegradable. They are FDA approved, including chitosan is FDA approved, if I'm not mistaken. And one of the reasons is their good biocompatibility and biodegradability profile. So once they get the drug delivered, they can happily biodegrade inside the body and then get eliminated out of the body, which is not the case for inorganic materials. Inorganic materials, why we are aiming our inorganic nanoparticles for the local or intravesical drug delivery, is because if they are delivered systemically through some sort of injection, if they get into the bloodstream, it will be very difficult to get them eliminated because they cannot biodegrade. Well, they will degrade probably at some point, but not as fast as polymer material would. But there is another side of the coin for the polymer-based biodegradable materials, is that if they are too biodegradable, they probably exhibit poor mechanical properties. But they have to have good mechanical properties to actually hold as a carrier the drug and everything you're trying to load inside, to hold it inside. But without good mechanical properties, they will not be able to even deliver to the targeted site. So there will always be a balance needed to be found between mechanical properties and biodegradability profiles of the material.
Yeah. So how do you usually do you have any kinds of methods to increase the mechanical properties of polymers?
Yes, for polymers you can alter the mechanical properties. You can add for example, synthetic polymers to your natural. Chitosan is a natural polymer, so you can add some synthetic polymer. You can copolymerize, make a block copolymer, and the synthetic component of the system will enhance the mechanical properties. It will also contribute to the biodegradability profile, but again, you have to find a balance.
Thank you.
So when we hear about the changing mechanical properties or any other properties of nanoparticles, instantly what comes to my mind is how exactly do we check these properties? Like how do they change over the time?
The properties of nanoparticles.
Yes.
The first thing after you made them, after you synthesized your nanoparticles, you have to fully characterize this. First of all, the size, the morphology. The size can be measured via dynamic light scattering. Also, the morphology can be checked via microscopy, different types of microscopies, scanning electron, transmission electron microscopy. And by the way, these microscopy tools can also provide you with the size. It will differ from the measurements provided by DLS, and the true size will be somewhere in between those two parameters. And then if you have loaded the drug, then of course it will be the drug release profile, drug release kinetics to be studied to see in vitro, first in vitro, how fast or how well your drug is getting released out of your system. Because when you're loading the drug inside your nanoparticles, there should be a rationale of using this nanoparticle-based matrix. Otherwise, why would you want to have any foreign body on top of the drug itself in the body if the drug can be delivered on its own without any carrier? So the benefits that this nanoparticle carrier provides need to be overcoming any drawbacks of the system. So as long as they provide the benefits and overcome the drawbacks of the drug itself, then it is a rationale of using the nanoparticle-based matrix.
For in vitro studies, we usually do not use animal models. Am I correct? We just mimic the internal conditions of our bodies to check how you said, how the drug release would work in these conditions. But do we also shift to the in vivo studies with nanoparticles?
First, you always have to check everything in vitro. So on cells, you can even use human-derived cells. But then the next step of testing your either a drug or drug delivery technology will be in vivo, meaning testing on animals. And for this, you can use different animal models. And for large pharmaceutical corporations, they use all the possible models that are currently available, starting from mice, rats, pigs, dogs, monkeys. Yeah.
Okay.
So before going to clinical, you have to test this on animals.
And after that, we switch to more human bodies.
Yes.
Thank
That
you.
even though even been tested on all the possible models, sometimes you might have some issues finding the correlation between animal model and the clinical trials. So this is a
Yes.
problem of pharmaceutical industry.
So you mentioned also the immune response to the nanoparticles, like it can have some drawbacks on some kind of our organs. So what do you think, what's the future potential of nanoparticle delivery in the future?
I still believe nanoparticles provide great benefits for the drug delivery area and field as a whole. And as long as the nanoparticles outweigh the drawbacks, then they will have a really great future to be used as the drug delivery vehicles.
Do you plan on researching other scientific fields other than nanoparticles?
Yes, we are now thinking of switching to liposomes. Liposomes is probably the subject that many of us became familiar with, thankfully to the COVID vaccine development. And one of our future plans is to switch to liposomes gradually.
So liposomes, are they somehow connected to lipids?
Yes. We haven't made them yet, but we will learn how to.
Thank you.
So they like have similar properties to nanoparticles? They also like used
Yes,
to
they
be...
can be made of a nanoparticle size, but their properties will be different.
Oh.
So as the drug molecules or biologically active moieties that can be delivered with liposomes are also different.
I think we could conclude here. Actually, I was very, at first, not really familiar with nanoparticle theme. However, with during this conversation with you, I have learned a lot of things about the nanoparticles, how they are used, what could be done with the modifications, how they are actually very diverse tool for drug delivery and therapeutics. I was also shocked that there are like different types of nanoparticles and that their size is like quite very, very small. It's actually hard to imagine that the nanoparticles are nanometer scale, which is like if I remember correctly, like 1 billionth of a meter, right? Or
For 1 to 100 nanometers.
1 to 100 nanometers. Yes, that's
so
very,
with the
very
naked
small.
eye, you will not be able to see
Yes,
them.
we have to use very strong microscopes to visualize them. So
yes, I also learned a lot of things. So if we go through to our conversation, we learned about your work experience, which was very interesting to me, because I think there are a lot of students in our university who also want to try themselves in the USA or South Korean in other corporations. So I think it was very insightful to learn about your experience. And also about the nanoparticles, we went through about their types, with what specific type of nanoparticles you work with, and what kind of chemical groups, about pegylation and thiolation. So it was a lot of new information for me today also, and I was very curious to learn about how the drugs are inserted like into the nanoparticles. I didn't expect that it could include some kind of solutions, the different phases. I don't know, for me it was like some kind of like engineers working to kind of design them into, yes, so it was, I was very like had no knowledge about it, no background. So but thanks to you, I learned about these interesting facts today. So I think Amanbek, yes.
How about your impression of our podcast?
Yes.
Again, thank you very much for inviting, and I think it is truly a great initiative, and I'm more than happy to support you in all your endeavors. So please feel free to get in touch. I will always be open and happy to help.
Yes, thank you.
Thank you very much, Dr. Mun. So as for our audience, we want to thank you for tuning in to a new SciPod. We hope that you enjoyed today's journey into the latest scientific research in the nanoparticles field.
Yes, so stay curious, stay inspired all the time, and we'll catch you next time.
Peace.
Goodbye.